Welcome back to Studio 17. Our next guest is here to help you achieve the body you've always wanted. Please welcome Dr. Jon Wilensky with Beautologie Cosmetic Surgery. Hello.
Thank you, Shannon. Thank you for having us today.
Yes, and we're talking about something super fun today, the Brazilian butt lift. Can you talk to us about what that is?
Absolutely. So hard to believe, but this has become one of our most popular procedures now. I think aesthetic ideals have changed over the years, and so 10 or 15 years ago, it may have been a larger breast size and a thinner waist or a thinner silhouette. But now patients are coming to us and they want wider hips and rounder, more curvature to their gluteal area. And so this procedure that we've developed, the gluteal augmentation, or what's called the Brazilian butt lift, is just off the charts popular now.
Yeah, and it's crazy to see, like you mentioned, the trends of different body shapes and everything. I'm happy we've gone away from that like stick, thin. That just wasn't healthy at all.
Absolutely, exactly.
And back to the BBLs, what exactly is it, and what's the procedure? What does it take?
So let's take a little bit of the mystery out of it. It's really just combining two of the most common procedures in all of plastic surgery. So we do liposuction, where we harvest fat tissue from various areas of the body, typically from the tummy and from the sides, and maybe from the upper and lower back. So that's the liposuction piece. Then we prepare the fat in a special way, and then it's transplanted or transferred to the gluteal, to the buttock area, in what we call a graft, actually. So it's really just combining those two procedures together. And so while it's very popular to call it Brazilian butt lift, because that's kind of where it was pioneered in Brazil, we more think of it as a gluteal augmentation or gluteal enhancement with fat grafting, just like you'd think about a breast augmentation or a breast enhancement. It's just taking an area of the body that the person wants to make bigger or with more curvature and improving it to achieve that ideal.
Well, I guess that's kind of two birds with one stone. You get a little bit of liposuction and then you get a bigger, rounder booty.
Exactly correct. So if we're going to take that fat out anyway, and normally it will just be discarded, and there's an opportunity to repurpose it, as we say, and that's something that the patient desires, then obviously we're thrilled to be able to offer that.
Yeah, and what's the recovery time like for that?
Yeah, so I generally tell patients that there's sort of a 2-week kind of non-negotiable recovery period where you just kind of have to be able to have some downtime. Specific to the gluteal augmentation, the big issues are really not being able to sit very comfortably for the first couple of weeks, because we really want to avoid pressure on that fat graft. We want to make sure that the fat graft will survive. And so there are many new pillows and cushions and all kinds of things that have developed as a result of this surgery becoming so popular that help people to sit and help to offload that area. And then for sleeping, it's very important to either be sleeping on one side or on one's belly, as opposed to sleeping on your back and putting that pressure. But after about 2 weeks, most people are doing really well and kind of feeling back to normal. But the recovery is a process. And I always tell patients, you have to just trust the process. It's not like a light switch where it's before the surgery and after. It's more like a dimmer. And so you just have to kind of go through the gradual process of healing.
Well, and what I love, I follow you guys on Instagram, and I love seeing the before and after photos.
Wonderful.
It's cool, and you guys always say like which doctor did which procedure, which I love. And I also love that you guys have this book as well, Making the Cut. We've had Dr. Shaw on before explaining the book, but can you give us a quick rundown about what it is? I think it's so important that our viewers read this.
For sure. So for our patients, we think that, it really is true. Knowledge is power. And the more information you have about cosmetic surgery going into it, the more prepared you'll be. And so our whole goal is to prepare our patients for surgery. That means the resources on our website, as you mentioned on Instagram, watching the videos, get to know your surgeon, get to know your procedure, get to know the experience. Because being in surgery, it's not an everyday experience for people. It can be uncomfortable. It can be a little bit creating nervousness. And so we want to put people at ease. Our book is an amazing resource because it helps people think about all of the considerations that we need to have when we're thinking about undergoing plastic surgery. And so we give this to all of our patients who come in for an evaluation, and it really is a wonderful read.
Awesome. Well, thank you so much. We have your information up here on the screen for everyone to reach out to you and get the book. Thank you so much. I love learning about all this. It's fun.
Wonderful. Great to be here with you today. Thank you.